Welcome to this video about one of the common clinical minor procedures, the aspiration of the ankle joint. In this video, we'll explain the academic steps of this minor procedure. First, we will explain the anatomy and the superficial landmarks of the anterior aspect of the ankle joint. We'll use the marker pen to mark the main anatomical structures. The first main structure is the medial border of the tibialis anterior tendon. After that, we mark the tip and the anterior margin of the medial malleolus. Here, and lateral to the tibialis anterior tendon, we determine the site of the Dorsalis Pedis artery, which is the terminal part of the anterior tibialis artery. And next to it, the deep peroneal nerve is located. And here is the suspected site of the intermediate dorsal cutaneous nerve. This is the lateral malleolus with the tip and the anterior border. This area is dangerous and it contains some important structures. Here will be the safe area for injection or aspiration between the medial border of the tibialis anterior tendon and the anterior border of the medial malleolus. After drawing and determining the superficial anatomy, we start the cleaning and disinfecting. We should disinfect as wide as possible of the anterior, lateral and medial aspects of the foot and ankle joint. Then, and after applying the sterilized drape, we dry the area by using a sterilized gauze sheet. At the site of aspiration or injection, we inject about 1 to 2 ml of lidocaine 2% deeply and superficially to apply local anesthesia before inserting the white needle. By applying a continuous pressure at the medial border of the tibialis anterior and pushing it laterally, we insert a wide needle or cannula at the middle point between the tendon of the tibialis anterior and the medial malleolus. The tip of the needle should be directed toward posterior and lateral. It should be inserted gently to avoid damaging the cartilaginous surfaces of the joint. Finally, we aspirate the fluid that collected inside the joint and take samples for biological and laboratory studies. The dressing and the grip bandage should be applied at the site of aspiration to prevent swelling and collecting of extra amount of the fluid inside the joint. Thank you for watching and I hope that this video was useful for you. See you in another videos.